Right, so if you have read and understood, considering it history-taking station, please begin.
Okay, good evening. My name is Dr. Daniel Raza, and I'm a surgical doctor. I would like to confirm your name and age, please.
Yeah, my name is John, and I'm 67. My name is Maria, and I'm 67-year-old.
Pleasure to meet you. So today I'll be asking few questions regarding your health. Is that okay?
Yeah, okay, right.
All right. So what has brought you here today?
Yeah, doctor, I falling down, and also my body is starting to shaking.
Okay, I'm really sorry to hear about that. So let's work together to find some relief. So can you tell me exactly what happened at that time?
Yeah, really, the doctor, this happened to me 2 times, and really, I can't remember. I lost my consciousness.
All right. So since when you have been experiencing this?
Yeah.
Since when you have been experiencing this?
Okay, this is from the last 1 year.
Okay, for the last 1 year. So
Yeah.
was this the first time you had this shaking movement, or you have previously experienced the same episodes in the past 1 year?
Yeah, from the past 1 year, this is the first time.
This is the first time.
Yes.
All right. So did you remember the event accurately?
Yes, doctor. Before this event, I see some flashes, something like this, and then I can't remember nothing.
All
Just
right. So,
I feel I found myself in the ground.
oh, I'm really sorry about that. So did anyone else witness this episode?
Yeah, yes, my
Okay.
sister.
Who? Oh, okay. All right. So what did she tell you? That did you fall somewhere, or did you bump your head to the floor?
Yeah, he just told me I'm shaking all my body, my hands and my legs.
All right. So all of the body was shaking. All right. So
Mm.
before the event, did you remember? Did you get any warning signs like chest pain, like nausea, or any fearfulness?
It's just like flashes. I see flashes of light.
Okay. So do you when you regained the consciousness, when
Mhm.
you were completely awake, so how did you feel at that
Yeah,
time? Did you feel any body pain, muscle aches,
yeah.
confused,
I just
difficulty in
found.
speech?
Yes, I just found myself. I'm waiting in my clothes.
Okay. So other than that, did you just told me that you lost control over your pee? Did you lose control over your poo as well?
No, no, just to be.
Okay. So did you feel any lip smacking movements?
No, no, no.
Any excessive eye blinking?
Yeah, yeah, yes.
Okay. So have you previously been evaluated for any infections in your brain?
No, no, no.
Okay. So did you have any fever?
No, doctor.
Any stiffness in your neck movements?
No, no, no.
Okay. So did you have any weakness in your arms or legs?
No, doctor.
Did you throw up?
No, no.
Okay. So have you experienced any visual changes during the past 1 year?
Yes, doctors.
Okay.
I see. I
And
have this blurred visions.
all right. So, apart from that, have you ever noticed any complaint of headache?
Yeah, sometimes there is headache. Yes.
Okay. So do you see your general practitioner for any other medical conditions?
No, no, no.
Okay. So have you ever had any surgery done?
No, doctor.
So have you taken any medications for any conditions before or for
No,
these seizures?
no, no, no.
All right. So is there anyone in your family has had the same complaint?
No, doctor.
Okay. So what do you think the cause of this complaint is?
I really, doctor, I think this may be cancer.
Oh, I'm really sorry to hear that, but it's too early to say that. And I assure you that we will do every investigation to find it out for the causes. And what are you most concerned about it right now?
Yeah, this just it to be cancer.
We will do
Okay.
our best to find out the best treatment for you. And what
Yeah.
do you mind if I ask you some personal questions?
Yeah, go ahead.
Okay, so what do you do for a living?
I'm housewife.
And whom do you live with?
It's my husband and kids.
Okay, and so do you drink alcohol or do you smoke?
No, no, no.
All right. So, is there anything you just want to add in this conversation that we have not discussed yet?
No, no, no. That's fine.
Okay. So one thing I missed in the history, that how many times during the past 1 years you had the same complaint?
2 times.
Okay.
Two
Can you
times only. All
summarize
right.
your history now? Thank you.
Thank you so much. Okay, so I have taken history from a 67 years old lady, and she has no prior comorbids, as she has told me that she has no other comorbids. She presented to me for the complaint of 2 episodes of seizures in the past 1 year. Uh, During the episodes of seizure, she has lost consciousness, and the episode has witnessed by her sister. And during the episode, she has lost control over her urine. And in the post-ictal phase, in the after the seizures, she did not remember anything clearly. So before that, she has not been evaluated for any CNS infection. The seizures are not associated with any neck stiffness, fever, or any focal neurological deficits.
So,
There is
was there
no
any
family
aura?
history.
Was there any
Uh,
aura?
yes, as per the patient, she just told me that she just saw the flashes of light during the event, and she did not have any warning signs before the seizures.
So, depending upon the history that you've taken, what are your provisional and differential diagnosis?
Yes, the provisional diagnosis includes the epilepsy.
Okay,
The differential diagnosis could be the electrolyte imbalances.
right,
Other than that, it could be cerebral infections. That could be meningitis and syphilitis. And down the list, we can also put the brain tumors.
right. How would you manage this patient? What investigations would you ask for?
Yes, as this patient has presented in accident and emergency department, I would manage this patient according to the ABCD approach. And when it comes to the investigations, I would run the blood test that includes the CBC, urea creatinine electrolyte, calcium, and magnesium, and the blood sugars as well. And apart from that, I will do the clotting profile and LFTs.
All right.
And
So, what
and
treatment would you suggest for this lady?
yes, as uh, for the acute management of seizures, the first line of management would be to bring the patient in a safe place
Yes,
and
you've already said yes.
roll over to one side. And it starts with the first line medications that includes the benzodiazepines, that includes
Okay,
the diazepam, 20 mg stat, and second line medications would be the phenytoin that includes the
okay,
20 milligram per kg.
yes,
And if the seizures are not controlled, and if the patient is in status epilepticus, then I
yes.
would manage the patient, and I would intubate the patient with the propofol.
Okay, right. Anything else?
Yes, as per the ABCD protocol, and yes, and obviously treat the underlying cause. That includes the electrolyte, uh, the management of the electrolyte imbalances, and
Yes,
if there is any any pathology in the imaging, then I would treat it.
Good, thank you.